Living with Cancer and Sleep. Episode 1, The Game of Sleep. Sleep problems when you are living with cancer. Hello and welcome to the first of several podcasts about sleep and cancer. I'm Dr. Petra Kageleder, a counseling psychologist with the psychological care team here at the Berkshire Cancer Center. With me in the studio today is Matt Williams. Matt is a senior program manager for mental health with the Oxford Academic Health Science Network with a particular interest in digital therapeutics. He has over 25 years experience working within the mental health, education and voluntary sectors. Matt leads an intervention for an Oxford eating disorder program and has previously worked with Big Health and Sleepio. He often gives talks and presentations to help encourage better sleep and is something of a sleep evangelist. Matt is also a Samaritans volunteer and is passionate about music and the arts. So welcome, Matt.
Thank you very much.
So today's episode is about how common sleep problems are in cancer patients and why they might occur. So, here's the first question right away. How common are sleep problems in cancer patients?
Well, sleep problems in cancer patients are very common. Understandably, quite often, there's a physical dimension and a mental health dimension, and just the anxiety, the worry of a cancer diagnosis actually, can really disrupt people's sleep. Also, the treatment regimes might upset and disturb sleep, and that's not just for the patient, but also for their family and those around them who care for them and are worried about them. So, if you have a cancer diagnosis, it's quite likely that you'll also have disrupted sleep at some point during your treatment and your journey through cancer.
Mm-hmm. And it's also very good that you mentioned the relatives, the loved ones, who obviously are also affected. So I think it's really important to mention that.
Absolutely, because worrying about a loved one is perfectly natural. It's understandable, and in the wee small hours, sometimes people are, they're worried about their mum, their dad, their brother, their sister, or whomever, and they'll be tossing and turning. And it's not just the patient who experiences poor sleep during that time.
Absolutely. Okay, so how does the scale of the problem compare to the general population in the UK?
Well, sleep problems in the general population in the UK and indeed around the world is probably higher than you think. About 10% of the UK population will have insomnia at any one time. And I talk to a lot of people who think, conceive of insomnia as not being able to sleep at all. But actually the definition of insomnia is, 2 or 3 nights disrupted sleep every week for a period of 2 or 3 months. So that's actually quite a low threshold. And about another additional 40% of people have sleep problems at any one time. So actually, I think as a nation and as a population globally, we are quite sleep deprived. So it's not just people with cancer and other conditions that have poor sleep. Actually, any one of us, can have poor sleep either for a particular period of time due to worry or stress, or just in general. And you do hear people who go, I never really have a good night's sleep. I never feel well rested. And to be honest, if somebody has a sleep problem, the definition of that is actually very subjective. If you wake up every morning not feeling refreshed, not feeling ready for the day ahead, then it's likely that you have a sleep problem. So it's more common than you think.
Mm-hmm. Yeah, it's just quite shocking figures, really, statistics that you quote here. And I do recall that also when speaking to patients in my practice, when I ask them, do you sleep well? Sometimes they say, yes, I sleep 7 hours. And then when I ask the question, do you wake refreshed? And the answer is no, absolutely not. So clearly, even though you might get the hours in, you still might have a sleep problem.
Absolutely, and and that's it, isn't it? People get fixated on the 7 hours sleep or however long is the latest recommendation. But actually, if you don't wake up refreshed, you're not sleeping as well as you might.
Absolutely. Now, if you just bring it back to cancer patients, as you say, it's of course understandable that the worries and everything would impact sleep. But in my experience, it's not only cancer patient who goes through active treatment, isn't it? And I wonder, in your experience, are people who have completed their treatment also affected by these sleep problems?
Well, absolutely. If the general population, about sort of 40 to 50% of the general population at any one time has a sleep problem, then there are going to be people who fall into that category. And of course, perhaps it's more understandable that, when people are going through treatment, and that might be quite, difficult to bear, it might, have real implications. But actually beyond that, again, there are psychological components to sleep, and quite often those are things that arise and don't go away. It's not like I'm in remission, or I'm finished my treatment and therefore I should be sleeping better. It doesn't necessarily work like that, and worries and anxieties can affect any of us, and that's why quite often the best forms of treating poor sleep are psychological rather than, say, medicinal or around sleep hygiene.
Mm-hmm. Yeah, and I have to say that's also what I see in my own practice. So that is basically what we've done now, is we kind of scoped out a little bit the problem. But now the question arises, why? And I think you already hinted at that a little bit, but let me ask you the question, why do cancer patients and cancer survivors have sleep problems?
Well, again, if we sort of look at this in different sort of arenas, so that first of all there are the anxieties, the worries. It's people talk about mental health, and I encourage people to talk about mental health an awful lot. And often people, it's quite understandable for people with long-term physical health condition to suffer from anxiety and depression, or to experience anxiety and depression. And of course, there's a bidirectional relationship with anxiety and depression and poor sleep. So if you're anxious, you don't sleep well. If you don't sleep well, you become more anxious, and then sadly it can be a vicious cycle. So quite often that can be something that people encounter. I think there's also things around physical discomfort. People who have poor sleep sometimes have long-term pain conditions, or discomfort, and that could be because of treatment, or just because their cancer is very painful. Again, that's understandable that these things disrupt us. I think anything that sort of disrupts our equilibrium when we're trying to sleep, whether it's on our mind, things playing on our mind and going round in our mind, and quite often people, when I'm on the phones at Samaritans in the middle of the night, people often are worried because they're not sleeping for whatever reason, or they're worried because they haven't slept, and they know how detrimental that is to their health. And by the same token, sadly, if people are in pain because of the treatment they're having, or because of the cancer, that can be very, very disruptive to sleep. And of course, how one approaches that to ease that and encourage sleep will depend on it'll be as individual as that patient or that person, and that might be a range of sort of around pain relief, and also perhaps meditation or anything like that, which can help encourage a good sleep environment and encourage sleep to come.
Mm-hmm. And I think, again, what you said is really important, this idea that what might help one person is very, very individual. So what we can't do here is provide the silver bullet.
Absolutely. And I think that's the key thing to have. And, in the same way that not everybody needs 7 hours sleep. Some people can get by on 4 or 5 hours sleep. Some people need 10 or 11 or 12 hours sleep. Everybody's different. And their solution to that will be different, and their worries and their circumstances, their context is always different. So absolutely, we need to really think about sleep on an individual basis, rather than saying, draw your blackout blinds, keep all of the kind of the general advice. That's good advice in and of itself, but actually when we're talking about individual patients, individual people, it's really about finding the solution that works for them, and really I would like people to give more time and thought and encouragement to people to have a better night's sleep, and really find out what works for them, rather than trying to shoehorn a kind of a one glove fits all scenario on somebody's life, because actually it won't work for them.
Absolutely. And in the next episode of this podcast, we're going to talk a lot more about potential approaches, if you want, to helping get that good night's sleep. In context of this question, actually, I did go away and ask our clinical nurse specialists in the Berkshire Cancer Center, what their experiences were in terms of why their patients sometimes struggle with sleep. And in addition to what you just said, and this is exactly what they said as well, but in addition to that, they also mention very much the side effects of treatment. So we are talking here hot flushes, night sweats. And I think it is important here to, at this point, to acknowledge that this can happen basically in both males and females as a result basically of hormone treatment. And also things like having to get up to pee basically, diarrhea, and if depending on the treatment, let's just name it, sometimes you need to empty the colostomy bag. These sort of stuff that matters. I think it's also worth thinking about, or at least acknowledging, that sometimes people with cancer care for other people. So they then need to get up in the middle of the night to deliver care or to soothe the baby or whatever it is. All of these factors play into this as well. So it's not only, although it's a big part, the cancer, if you want, experience, including treatment, but also life itself in addition comes into this.
Absolutely. And I think, it's one of those things where, obviously we're creating a podcast which we hope will be helpful to people, that will give people sort of encouragement and support and what have you. But there are never any easy answers with these things. And like you say, getting up to go to the toilet multiple times a night is sometimes a feature of a condition. And, there's nothing easy, there aren't many things you can do to kind of resolve that. It's part of it, and the same with the caring responsibilities. That's a really important part of that person's identity and who they are and where they're at, and that's why sleep is so contextual, and why sleep labs are great to study people's sleep, but it's not where or how people sleep. Do you know what I mean? So again, it comes down to that individual tailoring that approach. And I think if we're able to be more kind of open-minded and kinder to people when they're expressing what it is their worries about these things and talking about that, that's a really positive thing as well, because these worries and concerns are legitimate. If they're stopping you from sleeping, they need to be addressed. So I think that conversation is always a good one, and those are really important points, because actually it's easy for me to stand up and say, again, go through sleep hygiene, but that might not be somebody's reality. We have to accept that and acknowledge that.
Absolutely. And for me, it boils down again to the individual, their circumstances, their entire, if you want, environment, all plays into this. And with that, let's conclude this part of the podcast. Thank you, Matt, for talking to us today about sleep and cancer, and I'll speak to you again at our next episode about strategies to encourage restful sleep.
Thanks very much.